In this recording, we are going to discuss the use of the environment in a therapeutic manner to control and deliver care. Chapter 8 in our mental health textbook talks about the therapeutic milieu. It's important to review the key terms, explain what milieu therapy is and what the role of the RN is in providing that therapy. Understand the 7 assumptions of a therapeutic community and the conditions that characterize a therapeutic community and the members of the interdisciplinary team. Milieu therapy is the scientific structuring of the environment, so it's purposefully structuring or manipulating the environment in order to affect behavioral changes for your clients and to improve the psychological health and functioning of those individuals within that population. The goal really is to manipulate that environment so that all aspects of the client's hospital experience are considered therapeutic. Your role as the RN in delivering milieu therapy includes ensuring that the client's physiologic needs are met. So that's Orem, ADL, Maslow. Providing reality orientation, providing medication administration, developing a therapeutic relationship with the client, setting limits on unacceptable behavior, and being consistent across care providers, and providing appropriate teaching so that the client can become more independent and successful on their own. Topics for client education would include ways to increase self-esteem, ways to deal with anger appropriately, stress management techniques, how to recognize signs of increasing anxiety and intervene to stop progression, the normal stages of grieving and behaviors associated with each stage, assertiveness techniques for more effective communication, relaxation techniques, medications and information about why they're taking them, the harmless side effects and what to report to a physician, the importance of taking them regularly and when to take them and how to ask for them appropriately, and why not to stop taking them abruptly. It's important to educate our clients on the effects of different substances on the body, such as alcohol, stimulants, hallucinogens, narcotics, and cannabinoids. We help them develop problem-solving skills and using techniques that stop or switch negative thoughts, so thought stopping and thought switching techniques. Sex education is important in the mental health world, including how to prevent sexually transmitted infections. Nutrition is also important. The exploration of spiritual needs, management of leisure time, and strategies for goal setting and goal accomplishment. When providing education to parents and guardians, we want to also include signs and symptoms of substance abuse and information about effective parenting techniques. In order to have a therapeutic community, there are 7 basic assumptions or kind of conditions that need to exist. The first is that the health of each individual is to be realized and encouraged to grow. So we're going to focus on the strength of each individual within the group. The second is that every interaction is an opportunity for therapeutic intervention. We want to make the most of our time with these clients, and we want to structure the therapeutic milieu to be as therapeutic and effective as possible. So always think about the fact that you have the ability to make a difference with every single interaction. The third is that the client owns his or her own environment. It's really important that we teach autonomy and accountability. Each client also owns his or her own behavior. They should take responsibility for the things that they do. Peer pressure is a very useful and powerful tool, and that helps establish group norms. Feedback is important as well and should be very direct and frequent. Inappropriate behaviors are dealt with as they occur, and they should be dealt with based on the behavior and not on the outcome. Restrictions and punishment are to be avoided unless someone is dangerous, and then they should be removed until they can be safe again. The characteristics of a therapeutic community include one where basic physiological needs can be fulfilled, physical facilities are conducive to the achievement of goals in therapy, a democratic form of self-government exists, and we basically have community meetings. And during those community meetings, we discuss unit concerns that are common problems to everybody. These really are not therapy sessions. We're not focusing on treatment or personal problems, but more group or community issues. Responsibilities are assigned according to client capabilities, so everyone is expected to participate to the best of their abilities. Again, we're focusing on strengths, and that helps build self-esteem. And a structured program of social and work-related activities is scheduled as part of the treatment program. Community and family are included in the program of therapy in an effort to facilitate discharge from treatment. So we want to improve the likelihood that they will have a successful discharge to home. The interdisciplinary team includes everyone who collaborates together to create this therapeutic environment and to enhance the outcomes for our clients. And that includes the psychiatrist, the clinical psychologist, the psychiatric clinical nurse specialist, and the psychiatric nurse, the mental health technician or psych aides, the psychiatric social worker, the occupational therapist, recreational therapist, music therapist, art therapist, psychodramatist, anyone who helps people express and explore their feelings and experiences. Then we have the dietitian, who again helps enforce the importance of nutrition and proper meals, and the chaplain, who can provide spiritual advice and support. So that is really the therapeutic milieu in a nutshell. Remember that that doesn't apply just to mental health. The most important thing is that no matter what setting we're in, we're trying very hard to make it therapeutic and to meet the needs of the patient. And at the same time, we are utilizing ourselves as a therapeutic measure in every interaction that we have with the client in order to get the most out of the time that we have with them.